Good afternoon and welcome. I'd like to welcome you all to our webinar, Schools Are the Key to Improving Student Health, How States Can Leverage Medicaid Funds to Expand School-Based Health Services. Thanks for joining us today. My name is Rochelle Davis and I'm the President and CEO of Healthy Schools Campaign. We are pleased to be hosting today's webinar. We will get started by quickly reviewing the logistics for today. Next slide. The webinar will run for approximately 1 hour, and a recording of the webinar and presenter slides will be available to view after today. We have allotted time for your questions. You can ask questions by typing a question into the questions box located on your control panel and click on the send button. Feel free to send questions throughout the presentation. The questions box, Feel free to send questions through the questions box at any time during the presentation, and we will answer as many as we can during the question and answer session at the end. Next slide. I'd also like to take a moment to thank the supporters of Healthy Schools Campaign's work on this issue. Their support makes webinars like today's possible, and we greatly appreciate their commitment to this work. Next slide. We have a wonderful lineup of speakers joining us today. We have Anand Parekh from the Bipartisan Policy Center, Alex Mays from Healthy Schools Campaign, Wayne Lewis, former Kentucky Commissioner of Education, and Christie Putnam, former Deputy Secretary for the Kentucky Cabinet for Health and Family Services. Next slide. The focus of today's webinar is the important opportunity to enhance the role that Medicaid plays in schools while creating a sustainable source of revenue to support school-based health and behavioral health services. In December 2014, the Centers for Medicare and Medicaid clarified that Medicaid would reimburse school districts for health services they deliver. School districts, once restricted to reimbursement for services under very specific conditions, are now permitted to cover all eligible services delivered to all Medicaid-enrolled students. Simply put, this means more healthcare funding for the most disadvantaged students. This webinar is part of our activities to mark the 5th anniversary of the opportunity CMS provided, and we hope it will leave you energized and excited about pursuing this opportunity in your states and communities. We'll begin with an overview of why school health services are critical to student health and learning, and then we'll learn more about the progress that has been made in the 5 years since this change. Then we will hear from Wayne and Christie, who spearheaded this work in Kentucky. They will provide us with their firsthand experience in expanding Medicaid-funded school health services in Kentucky. We will end by sharing some concrete steps that you can take to move this opportunity forward through your work, and we will save plenty of time for your questions. Next slide. Before I hand things over to our first speaker, I wanted to give a brief overview of Healthy Schools Campaign. Healthy Schools Campaign's work is based on the simple common sense notion that healthy students are better learners. Since 2002, we have worked in Chicago and across the country to advocate for policies and practices that ensure that all children, no matter their race, ethnicity, or family income, can attend healthy, safe, and supportive schools. For us at Healthy Schools Campaign, a healthy, safe, and supportive school starts with an understanding that students' well-being and health is a foundation for learning. Teachers have the resources and training to support student health and school wellness. The school gives students access to healthy food, physical activity, and clean air and water. The school actively teaches the knowledge and skills that help students make healthy choices. And most relevant to today's conversation, it is a school that provides access to care, including physical and behavioral health services, as well as dental and vision care. Healthy Schools Campaign has been actively working to expand access to school health care for more than a decade. First, to successfully advocate for schools to be able to seek reimbursement for health services they provide. For the last 5 years, we have had the honor and privilege of supporting many states in implementing this change. Today, we are pleased to share with you the progress made in the last 5 years and provide the opportunity for all of us to learn from Kentucky's journey to expand Medicaid-funded school health services. Next slide. Our first speaker is Anand. He is the Chief Medical Advisor at the Bipartisan Policy Center. Prior to joining BPC, he completed a decade of service at the U.S. Department of Health and Human Services, including serving as a Deputy Assistant Secretary for Health. He recently published a book, Prevention First, Policy Making for a Healthier America. We are very appreciative of BPC's efforts to find bipartisan support around critical issues facing this country and are privileged to partner with them on several occasions.
Rochelle, thanks so much for that introduction. Hello, everyone. Great to be with you today. I want to thank the Healthy Schools campaign for their leadership. Also want to thank my co-panelists and really everyone who has joined this call for the great work that you all do every day. As Rochelle mentioned, I'm at the Bipartisan Policy Center. We are a nonprofit organization in Washington, D.C. that tries to take the best ideas from both political parties to promote health, security, and opportunity. We have a pretty robust health program here at BPC. Personally, it's always been my mantra that it's health that provides the foundation and education that provides the acceleration for all of us to achieve our goals in life. And therefore, I think the place to perhaps start is for all of us to better understand and appreciate the bidirectional impact and relationship between health and education. Now, I think we're all here on this webinar today because we appreciate that health, and particularly mental and behavioral health, are critical aspects to ensuring optimal learning and are critical for education. Also, as important is the bidirectional impact the other way. Education is an important social determinant of health, and whether it's education leading to better health behaviors, improved health literacy, increased access to nutrition, physical activity, there are many ways through education policy that health can be improved. So it's really this bidirectional impact relationship between health and education that are critically vital, and I think we would all agree that breaking down silos between these two sectors are critical, and because of that, I'm very happy to be a part of this conversation today. Next slide, please. And so I want to just speak for a couple of minutes and summarize a report out of the Bipartisan Policy Center released last year focused on health and all policies, provide a couple of statistics that many of you are familiar with that speak to the health and learning connection, hone in on today's focus, which is school-based health providers as a critical solution, and then talk very briefly about some of the broader benefits beyond education of school-based health providers. Next slide, please. So last year, one of the projects that we undertook here at the Bipartisan Policy Center was really to focus on several non-health departments, which included the education department, to see how policies, programs, and activities in these federal departments could, in fact, further health. And it was through conversations with colleagues at the Department of Education, as well as in a better understanding of the Every Student Succeeds Act, that we really we identified a variety of areas where we thought mental health and wellness could be further prioritized. And some of the recommendations that came out of this report, particularly related to the education department at the federal level, focused in on the increasing need to integrate health and wellness within existing guidances, really to prioritize student behavioral and mental health needs. Also, the need for the education department to develop guidance for measuring chronic absence as a quality indicator in state plans, and we know that chronic absence is an important proxy for both mental and physical health, as well as this third bullet here, which is that the education department should support efforts to increase access to school health providers. And as most of you know, Title II of ESSA allows the education department to provide funding to state and local agencies to increase the number of personnel who are effective in improving student academic performance. And what we advise is that perhaps the personnel should be broadened to include health service professionals. And so there are many ways we believe that the education department could support a health in all policies approach, again, to improve health, which of course then goes back to improve academic performance. Next slide, please. So on the other way, the other direction is, of course, the numerous ways where health impacts educational outcomes. And here I think that the theme is that health matters. And this slide provides a number of statistics that really focus, I would say, on the emotional well-being and the mental health aspects of why we ought to care about this bidirectional impact. So we know, for example, that 1 in 5 children and youth have a diagnosable behavioral or mental health disorder. However, most of these children don't receive the mental health care they need. We know that only 40% of students with behavioral or mental health disorders graduate from high school compared to a much higher national average, almost double. And we know that many of these unaddressed mental health conditions in students absolutely affect educational outcomes, such as poor attendance and frequent absences, difficulties with academic work and social integration, and increased school suspension. So health absolutely matters. Next slide, please. And we see this also on the physical side, for example, 1 in 5 children are obese now in this country. There's data to suggest that overweight kindergartners have been shown to have lower scores than those at a healthy weight. We know food insecurity is also important. Children that are more likely to miss school, who are food insecure, are more likely to miss school. They're more likely to repeat a grade compared to those who are food secure. And we know physical activity is critically important as well. Those who are physically active tend to have better grades, display more on-task classroom behavior, and have higher rates of school attendance. Unfortunately, only a minority of children have access to an hour of physical activity a day. So we know both on the mental health side as well as the physical health side that there's an absolute connection to educational outcomes. Next slide, please. And so that takes us to, I think, that the topic of today's discussion is this idea that school-based health providers can be an important solution to improve health and therefore to improve educational outcomes. And in our 2019 report, we talked quite a bit about how studies show that healthcare provided in school settings, for example, reduce emergency room visits, thereby reducing healthcare costs. They also increase enrollment in public health insurance programs like Medicaid as well as CHIP. And there have been many accounts and data to suggest that strides have been made to address childhood obesity, asthma, mental health as well. But this particular third bullet, which I know Alex will cover as well, when I first learned of the data, I was really struck by it, this idea that more than half of public schools don't have a full-time school nurse or counselor, and less than 5% of the nation's students have access to services through a school-based health center, really struck me in terms of where we are and where we need to be based on the evidence as well as the data. Next slide, please. And I think when you look even beyond sort of the educational outcomes that we're focused on, just by virtue of children spending 1/3 of their lives, if you will, in the school setting, there's a tremendous opportunity to really take advantage of that setting. And if there are ways we can improve health, that's the benefit really of not only these children, but also society at large. So we know that access to mental health care services for kids can potentially reduce violence in schools. There could be less substance abuse, reduce crime. We know that screening for social issues such as food insecurity, which I discussed earlier, can lead to early intervention, can increase likelihood of educational attainment, productive employment, enrollment and coverage. And we know that screening, diagnosis, treatment of medical conditions can also, again, lead to early intervention, potentially healthcare savings, also increase health literacy. So there are many societal impacts even beyond sort of just the educational outcomes that we usually consider, and certainly beyond just the health outcomes that we consider as well. Next slide, please. And so I'll just end by saying that I think this notion and today's discussion topic of school-based health services, I mean, this is absolutely evidence-based. This is important for health. This is important for education. We believe it is a bipartisan issue. We believe that the opportunities here are immense. I think the idea of learning from early adopters, learning from vanguard states, learning for localities that are out in the front, I think is critical. The ability then to share best practices. I think the toolkit and the resources that the Healthy Schools campaign is sharing and has shared, I think is really, really important. So we're thrilled to be a part of the conversation today and happy to participate in the discussion. Thank you.
Well, thank you for providing us with such a solid framework on the health and learning connection and the important role of school-based healthcare. Next, we will hear from Alex Mays, Healthy Schools Campaign Senior Policy Director. Alex has been spearheading this work for us since she joined our team almost 10 years ago. Alex?
Great. Thanks, Rochelle. Next slide, please. And thank you so much to Anand for that great introduction about the importance of school health services. What I'm going to do today is dig in deeper around a new opportunity that Rochelle mentioned to expand school health services through Medicaid funding. Next slide. So as we heard so eloquently from Anand, there are tremendous societal benefits on multiple fronts that can come from expanding access to school-based healthcare. But unfortunately, we know that many students across the country do not have regular access to school-based healthcare. And we know that these numbers are even lower for schools that are serving larger proportions of low-income students of color. And also, while we know that there are many complex policy and system barriers that are impacting the ability of schools to be delivering school health services, one of the primary reasons we see across the country for why schools are limited in their ability to deliver school health services is access to funding. We historically, school health services are primarily funded by education dollars. And so that has really led Healthy Schools Campaign on this journey of looking at ways in which we can leverage other sources of funding to expand access to school health services and really work towards realizing those full benefits of school health services that Anand laid out earlier. Next slide. And so one of the primary sources of school health services, in addition to education dollars, historically has been school Medicaid. School Medicaid does play a really key role in funding school health services, and for the last 30 years, Medicaid has reimbursed school districts for services, specifically eligible services that are included within a student's individualized education program. And so this is, when we talk about expanding school-based Medicaid programs, I think this is a really important point to keep in mind because we're talking about expanding upon an existing system. School districts already are billing Medicaid across the country, but it's only for this very specific set of services. And we know that only about 14% of kids across the country have individualized education programs. And school health providers, are delivering services to many more students than those that just have individualized education programs. And so we really have been looking at ways in which we can build on that and how we can expand school Medicaid programs to leverage more of these dollars to support the great work that can be done in schools in terms of delivering school health services. Next slide, please. So fortunately, as Rochelle mentioned, about 5 years ago, the Centers for Medicare and Medicaid Services made a key policy change that really creates a tremendous new opportunity to expand school-based health services through Medicaid. Advocates and many others call this change the free care policy reversal, but what it essentially means is that Medicaid reimbursement is no longer tied to that individualized education program. So it reversed that longstanding policy that school districts could only be billing for eligible services included within students' individualized education programs. And this, again, just creates an incredible opportunity for states to allow school districts to access Medicaid funding to support this work. When we think about the types of services that states could potentially be allowing school districts to bill for under this, it's chronic disease management services, mental health services, substance misuse services, oral health services, occupational therapy, physical therapy, speech therapy, the list goes on, and it varies a little bit from state to state, but it is really any Medicaid eligible service within your state. And then in terms of providers, certainly school nurses are a big group that can be impacted by this, but it's also school mental health providers, such as licensed psychologists and social workers, and then also your occupational therapists, respiratory therapists, physical therapists, and many more. So this is really a chance to expand upon what has been an existing system of delivering health services in schools across the country and securing sustainable funding to support that work. Next slide, please. So where we are now, we are 5 years in, and I think we are all incredibly excited to see this policy change happen from the Centers for Medicare and Medicaid Services 5 years ago, and then quickly realized how much work we had cut out for us. Many of you on this webinar have been involved in the nuts and bolts of that work. But what we realized is that in the time that these restrictions had been in place, saying that school districts could only be billing for services included in students' individualized education programs, many states had written that language into their state Medicaid plans. And so in order for states to move forward with implementing this change, they needed to amend that language within their state Medicaid plan. Every state has a state Medicaid plan, and they're very much intended to be living documents. They're constantly updated, and there's a very set process for doing that. So by no means is this, an insurmountable barrier. It's just an extra step that states do need to take to move forward with this change. And I should note, not all states had this language written into their state Medicaid plan. There are some that were able to just update their guidance to school districts and make some additional smaller changes to move forward. But the majority of states do need to go through this process of submitting that request to Centers for Medicare and Medicaid Services to implement this change. And so initially what we saw is that states were cautious about moving forward with implementation of this opportunity. I think that was due to a number of factors. In part, while the letter came out from CMS around this policy change, it was not followed with new guidance for states and school districts around how to implement school Medicaid programs. And I think many states were hoping for that guidance to make sure that they were implementing the program, in a way that wouldn't open them up to audits and other issues. And then also, I think there were, genuine concerns from many states around the current presidential administration's support for Medicaid and how that would impact, school Medicaid programs. And so concerns around trying to move forward with this change within the current presidential administration. But what we have seen in the last year is just a tremendous amount of momentum building across the country around states moving to take advantage of this opportunity, which is incredibly exciting. I think that momentum is now being driven by a number of factors. One being that there were a couple early adopters, which was fantastic to see, that took that first step forward and move forward with leveraging this opportunity and expanding their school Medicaid programs. And that provided a roadmap for other states to follow and gave them language that they could use to submit to Centers for Medicare and Medicaid Services to make this change, and I think made states in general more comfortable with moving forward with this change under the current administration. And then also, unfortunately, just given the significant increased concerns around school safety and unmet student mental health needs and the opioid epidemic and suicide epidemic, there has been an incredible amount of pressure and attention on school districts and states around how to increase access to resources to support student mental health needs. And this opportunity creates a tremendous chance to do that and bring in additional funding to really, support all student health needs, but certainly mental health needs. And I think that really ended up serving as a catalyst for a lot of states' work around this. Next slide, please. So the next slide just shows a map of kind of where we are 5 years later in terms of states that have moved forward with expanding their school-based Medicaid programs through this change. The states in dark green are those that have received formal approval to move forward with expanding their school-based Medicaid programs. Florida, if anybody from Florida is on the webinar, I'm happy to have a follow-up conversation. They're a little unique. They had their request approved, but they need to change state law to move forward with implementing it. And then the states in lighter green have requests pending with Centers for Medicare and Medicaid Services. I think the important thing about this is that 6 of these states have really just moved forward with this in 2019. So of the states that you see up here, almost half of them did so in 2019, which I think just demonstrates that momentum that is building. We'll hear from Kentucky. They were one of the states, they received approval in fall of 2019. And we know that there are many other states that are working on this and looking towards moving forward with this opportunity in 2020, which is very exciting. Next slide, please. And so just to wrap up, I want to kind of emphasize some of the key points in terms of the potential impact of this change. This is, again, I can't say it enough, an incredible opportunity for increasing sustainable revenue for schools and for school health services. It's a little early in terms of implementation to have numbers from the states that have implemented, but we do have some initial projections. Georgia is a state that has a request pending with CMS. They have estimated that if they are approved to make this change, if they are able to seek Medicaid reimbursement for existing services delivered by just school nurses who are already working in the school, so not expanding their workforce at all, they would bring in an additional $48 million in federal Medicaid revenue to the state, which is just tremendous, and I think underscores the potential impact that this can have in terms of supporting school health services and health and wellness in general. And then also we're seeing many states using this as a chance to really think about the services and providers that are delivering services within schools. And as they go through that process of changing their state Medicaid plan and expanding their school Medicaid program, looking at this as a chance to also make sure that the services that they know their students need and the providers who are in schools delivering these services are eligible for Medicaid reimbursement. Michigan did a really nice job of this, and they added school psychologists as eligible Medicaid providers and school social workers, behavioral analysts, a host of other providers, which was great to see. And then I think the other points on this just really underscore what Anand said earlier, in terms of expanding access to school health services really is a strategy for improving access to care and reducing overall healthcare costs and improving academic outcomes. So I will wrap up there. I will hop back on after Wayne and Christie share their story to provide some more concrete steps about how you all can move this work forward through your work. So Rochelle, I'll hand it back to you.
Well, thank you, Alex, for providing that overview of progress made and lessons learned in the last 5 years. And thank you for the leadership that you have shown to so many states and organizations that has helped make that happen. Next slide. Now it is my great pleasure to introduce Wayne Lewis and Christie Putnam. Wayne Lewis is currently Dean and Professor of Education at Belmont University. He most recently led the Kentucky Department of Education as the state's Chief State School Officer from April 2018 until December 2019. Next slide. Christie Putnam is currently a policy advisor to the Kentucky Speaker of the House and to the Administration for Children and Families Office of Family Assistance. Most recently, she served as Deputy Secretary for Kentucky's State Medicaid Agency. Both Christie and Wayne were instrumental in the expansion of Kentucky's school Medicaid program. They will share with us the why and how they got this done. Just one thing to note, both Wayne and Christie began their careers in the classroom, so they have had firsthand understanding of why it is so important to support student health. First, we will hear from Wayne and then Christie. Next slide.
Good afternoon, everyone. Thank you so much for the invitation. I'm delighted to have an opportunity to share just a little bit of Kentucky's journey with the expansion of Medicaid to help to provide better health services for our kids. Next slide, please. To give you just a little bit of context on Kentucky's public education system, all told, there's a little more than 650,000 students in public schools in Kentucky. That's made up of 172 public school districts. 120 districts are those county districts. So every county in Kentucky has a public school district. But we also have 52 independent or city school districts and over 1,400 schools. In addition to that, we have 2 state-run schools, a Kentucky School for the Deaf and a Kentucky School for the Blind. Demographically speaking, over half of the kids in Kentucky, over 60%, qualify for free or reduced price meals. And so when Kentucky talks about kids who come from low socioeconomic backgrounds, you're talking about the majority of students in that state. And then you see a breakdown of students' race and ethnicity is 77% white, 11% African American, 7% Hispanic, 2% Asian, and then 4% of kids who identify as 2 or more races. So that's just to give you a little bit of context of the state and the public education system that we're talking about. Next slide, please. So where I'll focus my comments, and I will be brief and then hand it off to Christie, is on why. Why would a state or a school district explore this, or even better, move into this opportunity that's provided by the law? Well, first, in Kentucky, as with many states that are represented on this webinar, we have a particularly health-challenged population, both with adults and with children. It's no secret, it's been noted both within the state, it's been noted around the country that our population, our folks, while I would say are some of the greatest folks in the world, we've had challenges with health. One of past Kentucky governor referred to them as the Kentucky Uglies, as one of those being health in our state. And so there's a need for us to think out of the box and to leverage resources and do things differently than we've ever done before if we're really going to move the needle in improving the quality of life and the quality of health for our adults and for our kids. Now, schools, we believe, play a central role in that, because regardless of the community, whether you're talking about urban communities, suburban communities, or rural communities, typically schools are central to those communities. So that's the case whether you're talking about Jefferson County or Louisville, where there are elementary schools across the district. Even in urban environments, those elementary schools, middle schools, and high schools serve as hubs of their neighborhoods. To more rural districts where there may be a single elementary, middle, and high school. Every community has at least a school. And with that common element across the state, we believe schools then give you a really critically important vehicle for helping to organize communities, to reach communities, people in every community, and then as a way to situate health services so that you can have a broader impact across the state. Whether you're talking about a superintendent in Louisville or you're talking about a superintendent in Casey County, the desire to better meet the health needs and health outcomes for students is universal. In my time as commissioner, in my time in Kentucky, I never talked to a superintendent, a principal, a teacher who didn't believe that improving health outcomes for kids, ensuring that kids were taken care of from a health standpoint was important for ensuring that they're able to learn and ensuring that we're able to accomplish what we want to be able to accomplish for them educationally. And so the desire has always been there, and the desire continued to be there. But the truth of the matter is, in Kentucky, as in many of your states, there are insufficient state and local resources to provide the types of health services often that our kids need and that our kids deserve. And so this opportunity that has been presented with the federal law permitting us to make changes in the Medicaid state plan was really a no-brainer for us. In our case, Christie, who you're about to hear from in a couple minutes, came to me, told me about this possibility and said, is this something you all would be interested in? To which I said immediately, absolutely, yes. One of the things that we benefited from, and it's my hope that Kentucky continues to benefit from in the years to come, is truly an unprecedented degree of coordination and cooperation between the Department of Education and our human services agencies. And that degree of coordination and cooperation, I think, is really important here, both in terms of planning, getting that state plan change, but then as well in this implementation period, particularly this early implementation period, which Kentucky's in right now, because there are some logistics that you're going to have to work through. And so having a positive, healthy working relationship between agencies, I believe is important to not just creating the policy framework for this to happen, but to ensure that you can have successful implementation. So I'll hand off to my colleague, Christie Putnam, to talk a little bit about what the logistics of this look like as they applied for this change in the state plan and as we continue to get it off the ground. Christie?
Thank you so much, Wayne. Next slide. Thank you. That's perfect. Thank you, Rochelle and Alex, for coordinating this today, and just wanted to give everyone an idea of what this implementation, the journey looked like in Kentucky. And again, this was from Wayne and my prior work together in Kentucky, and we're in different roles now, but this was really a wonderful partnership, and so we're glad to share that all with you today. Next slide, please. So Kentucky's program before the change, and you all heard Alex go into a little bit more in-depth explanation of this, was that it provided services only to Medicaid eligible students who have an IEP. The following are examples of services that are provided under that IEP, and that you can see speech therapy and language services, physical therapy, occupational therapy. There are behavioral and mental health services, specialized transportation and nursing services. But those were provided only and funded through Medicaid only under those students covered by an IEP. Next slide. So some of the problems we identified, and again, you heard Wayne talk a little bit about this too, but these were more student specific and more focused on student health and student well-being, is we did recognize an increased need for mental health services. There is definitely a lack of a primary care provider for many of the students we have in our public schools. We wanted to have increased access to all students and not just those who are covered under an IEP. There is a desire to decrease absences, whether those are absences for physical health issues or for mental health and just challenges that students encounter in going to school that keep them from going some days. And then we also had the catalyst of new Kentucky legislation introduced as Senate Bill 1 last year that included a mental health requirement for schools, but no funding. So the problem was laid out for us very clearly. And when we had pre-care introduced to us, it was introduced to us in the summer of 2018. And when I say us, I mean the prior cabinet leadership. It had not been taken advantage of yet for the state of Kentucky. I know there's a good reason for that, because it does take quite a lot of effort to get the state plan amendment written, to make sure that all the partners are coordinated and working together, and then to get it actually through CMS approval process. So there's a lot of work to be done in getting this done. But it was not as long a process as I've heard it sometimes happen. So to those of you out there who are still working on this or maybe in the process, there is hope, and happy to answer questions on that or have follow-up discussion on that as a later conversation. Next slide, please. But we also had a bigger why, and Wayne touched on this also in Kentucky. We do have overall poor health outcomes as a state. We often are at the bottom or near the bottom of many of the health outcomes. We do have a very low utilization of prevention services. One of the big pushes in our health areas in Kentucky has been to improve individual engagement in their own health and well-being, and really an awareness of healthy habits. And so that's where we were looking at a why of increasing healthy family habits as part of this. There's also just a significant advantage in being able to address non-cognitive needs to improve academic performance and behavioral health, and just overall school health in general. And non-cognitive, of course, you're all probably aware, is anything that's not related to the actual academics. So it's it's food insecurity, it's health, it's mental health, it's all of the things that are part of a child, but that don't necessarily get addressed as part of an educational curriculum, but all the schools would like to address those challenges and those other needs. An improved outlook for the future, and I'll talk a little bit more about what that means and what I mean by that. And then a holistic approach to serving students. I really like what Anand said at the beginning, is his view is always health as the foundation and education as the acceleration. And I'm going to possibly steal that, as all good teachers steal really great things and use them in later lessons. Next slide, please. So in talking about just an overall holistic approach, everybody in health policy is talking about social determinants of health and how the actual healthcare system and the actual coverage and care is only a portion of those health outcomes. And you look at all the other factors that contribute to health outcomes, and it's the economic stability, it's neighborhood and physical environment, education, your access to food, community and social context. So all those things that happen in a daily school setting, that community that happens in school, are the social determinants of health. But the piece that's often missing, or that's frequently not adequately funded, is the health piece of it. And so those are all components that we view as very important in working together and supporting our students within the school setting. Next slide. The other, the improved outcome for the future, really that talks about looking forward. There is a very clear link between health and economy. The health of the population and the health of the economy are symbiotic. They relate together very closely. The reason Kentucky is really focusing on how do we improve our health outcomes is, we have very poor health outcomes, but we also have a much lower economy ranking than we would like to have. That's, cost of living wage and those sorts of things. So economic activity, economic health, the innovation potential, those are some of the metrics that are used in measuring a state's economic ranking. And so looking long term at meeting students' health needs within the school setting, really engaging them in the importance of preventive services, wrapping supports around them so that they can be more successful in the school setting, are all the things that we wanted to take on with this Medicaid in schools. Next slide. So I love this slide because this is the picture that I really like to think represents how we did this in Kentucky and a lot of the work that we did. We viewed ourselves as definitely silo busters, and we moved to work as a team focused on how are we going to improve student health and improve access to student health services within schools, regardless of the silos within which we had been working within a cabinet or an agency. So I would just encourage all of you, to the extent that it may not be happening if you're in government or if you're in school districts, just taking a look at, how do we serve the family and the child and look beyond, what does this program say I can and can't do? How do we combine forces so that we're not just working within those silos? Next slide. Just to give you an idea, and again, this is the process as it happened in Kentucky when Wayne and I were working together on it. Our teams and our cabinets were working on it. So our implementation timeline, we first learned that the opportunity existed in about July or August of 2018. We submitted a state plan amendment in April of 2019. We had a public comment section that closed 30 days later. Then there were some questions raised and some changes requested by the Center for Medicare and Medicaid Services. It's called an RAI, or Request for Additional Information. Some of you on this call may be in that phase right now. Just a little aside and a bit of advice that I would offer as part of our experience is some of the changes and questions and comments that you receive as part of the feedback from CMS, I would just encourage you to ask questions back and to, just really question some of the things that are being raised. What we found in that process is that some of the issues were simply comments. They were just comments. They weren't barriers to being able to implement. So I would encourage you to just ask questions and a little bit of a challenge is okay sometimes when we don't understand why something is being requested. We did receive our final approval on November 4th. I'm very, very happy to report that was retroactive to August 1st of 2019. So the school districts who wanted to and had taken on the Medicaid in schools, expanding that, were able to go back, or hopefully are able to go back and get some reimbursement for some of the services provided to Medicaid eligible students during that period. So what we did is we had a lot of ongoing communications. Our initial partnership with KDE, we approached KDE and made sure this was something that they were in support of and wanted to pursue. That being the case, they were very much on board, very supportive. We made sure that we were talking from the same talking points, that we were sharing information on where things were in the process, that we were going through each other's just communications circles, so that we were sending out information from KDE and questions vice versa through the Cabinet for Health and Family Services. We also engaged leadership in the school districts. Had ongoing discussions with the Kentucky Association of School Superintendents, the Kentucky School Boards Association, and then we held actual technical assistance sessions with school-based stakeholders. The ongoing implementation and what it looks like at this point is the Cabinet for Health and Family Services actually had an ongoing working group with the Kentucky Department of Education to have a template for the school districts to operationalize school-based care. Just 2 quick points on that. One of the surprising concerns that got raised was by the Kentucky Primary Care Association. So in your planning, you might think about, if you're already in the process or if you're getting ready to start the process, think about engaging those primary care association providers, because the concern was that school-based Medicaid would replace the role of the primary care provider in that student's life. And that is absolutely not the intent of school-based care. But it was a concern that we were able to discuss and to resolve with just a few conversations. So that is one thing that you want to just kind of think about is who's going to be a little concerned about this. The other concern, and Wayne can probably attest to this, is the school fiscal individuals, the district fiscal folks, were a little bit nervous about how are we going to implement this. And in Kentucky, we chose to implement it through the payment system that is already in place. And so once we were able to convey that to the fiscal folks, it alleviated a lot of the concerns that they have, although not all of them. There were still ongoing discussions, but that just a couple of quick conversations, we were able to have that. And those TA sessions that we had with other stakeholders included, we had Family Resource Youth Services Center coordinators who came on board, got trained, and understood what free care meant and what the impact would be to their school districts. We did work with individual school district folks and talked with them and met with them individually. And then we talked also with legislators and appeared before several different committees so that everyone would have an understanding, one, that this was coming and we were working on it collaboratively, but two, that it was also, for the legislators, it was also a partial answer to the Senate Bill 1 school safety bill that they had passed last year. Next slide. So specifically in Kentucky, the questions that we got, our experience was, what does this mean for my district? What does this mean for my school? And the way it is implemented, or it's being implemented here, is that each district can implement those services in ways that they identify best serve their unique student population. That could mean the addition of mental health care providers. It could mean bringing dental services into the school that haven't been there before. It can mean immunizations on site or an on-site clinic. There are a number of different ways that things can be implemented within a specific school district or a specific school. So those are some of the ways that we anticipate that we heard feedback from our districts and from our schools that they are going to plan to use free care. I know I've gone through a whole lot of information very quickly. Next slide. So as Alex said before, I think we are at the point where we may have some questions and some time to discuss. Thank you all very much.
Great. Thank you so much, Christie. I really appreciate it. Before we go to question and answer, I just wanted to provide a quick overview of some steps that you all can hopefully take to move this work forward in your state. I will go through this very quickly because I think Wayne and Christie did an amazing job of addressing a lot of these points, especially around action steps that you all can take in your states. And I know you all have questions for Wayne and Christie too. So next slide, please. I just wanted to share Healthy Schools Campaign actually today is releasing a new policy brief that provides an overview of a lot of the information that we've covered in today's webinar. And it also includes recommendations for at the federal and state level about how this work can be supported. So whether you're an advocate that's thinking about asks you can make at the federal or state level, or whether you're in one of those roles in terms of being a decision maker, it goes into a lot of detail about some of the steps that you can take to support that work. At the federal level, the Centers for Medicare and Medicaid Services has been largely supportive of this change and of states implementing this change. Christie mentioned kind of their back and forth with CMS around this. We're seeing CMS approve these requests, and our main ask is to continue to be supportive and support that work. And then also, I think there's a tremendous role that the federal administration can play in terms of issuing guidance and continuing to support states and school districts in rolling out that work. And whether that's through funding, technical assistance, issuing guidance, or supporting innovative partnerships and models to expand access to school health services, I think there's a lot of opportunity for that. Next slide, please. And then in terms of state level recommendations, Wayne and Christie spoke to so many of these. I think just bringing the right players to the table at the get-go is instrumental. And we cannot underscore enough the power of having strong cross-sector collaboration to move this work and breaking down those silos, having education and Medicaid at the table, but also having school districts and key health providers and others who are going to be impacted by this work and engaging them early. Next slide, please. And then just to wrap up, these are some key questions to think about, whether you're in a state that is already moving forward with this change, or whether you're in a state that's thinking about it. These are just some guiding questions that we encourage you all to think about to get started in this work in your state. And to really think about where the student health needs are. You heard how much that drove the decision making within Kentucky. And then just really developing a plan for the changes that are needed, but then also how that's going to get implemented and who needs to be at the table to drive that work forward. Next slide, please. And then we will send out a host of resources as follow-up to this webinar. I know we've received quite a few questions about whether the recording and slides will be available. Yes, they definitely will. We'll send out an email by the end of the week that includes links to the recording and slide, as well as a number of resources, including the brief that we're releasing today. We also have an in-depth guide that details how the nuts and bolts of really how to go into the weeds to move this work forward. And then we also maintain a state activity tracker with Community Catalyst and Trust for America's Health that we update regularly as states move forward with this change and share information via that. Next slide. So I know we have shared a tremendous amount of information with everybody. We will now open it up for question and answers. So please feel free to share those questions on the control panel of your webinar platform, and we will make sure to get to them. So one question just to kick us off for Wayne and Christie is wanting to better understand the cost to the state Medicaid program of implementing this change. So I don't know, Christine, maybe if that's something you could speak to, and then I can kind of speak to it from a national level as well.
I can sort of speak to it, and I apologize that I don't have any hard, fast data with me, but what I can say is that our discussions, and Wayne, please jump in as well, because you and I talked in depth about this, our discussions with school districts and our representation to our legislators was that there did not have to be additional funds allocated if that was not the direction that folks wanted to go. That there are many costs school districts pay for out of local and state funds already that could be possibly qualified for some federal reimbursement. Wayne, do you want to chime in here?
Right, I'm definitely not qualified to speak to the costs, overall costs on the Medicaid system. But in terms of cost to schools, Christie is absolutely right. Most of the services that school districts in Kentucky have expanded to provide, many districts were providing those services for kids who have IEPs and for kids who don't have IEPs already. The only difference in this case now is they're able to seek reimbursement for kids who don't have IEPs who are Medicaid eligible. But so in terms of additional costs to the district, there doesn't necessarily have to be additional costs.
And in terms of additional cost for the Medicaid state budget, we did not include an increase specifically for Medicaid school-based services. However, we did know that one cost that would be coming down the road as part of this was there was a requirement to do another random moment time study to determine cost allocation between programs when the schools are claiming direct medical services versus administrative costs, for them to be able to claim administrative costs. So our agreement with CMS to be able to continue moving this forward was that for the first year or until Kentucky was able to complete that random moment time study, the Kentucky school districts would not be able to bill for administrative costs. And so that was an agreement that we made that allowed us to go ahead and get approval and implement sooner rather than later. But we don't have enough information yet from reimbursements that have been submitted to know what, if any, additional cost it will be for the state Medicaid budget as part of the match for the Medicaid funds.
Great, thank you both. And I will just share from a national perspective. The way most states end up structuring their school Medicaid programs is that so Medicaid is intended to be their shared responsibility between the federal government and the state government, and the federal government pays a portion, but then the states are usually required to match that. And the way most school Medicaid programs are set up is that the school districts actually essentially validate that the amount of money that they're putting in to hire the school health providers and administer those services meets that state match. And so in many cases, we actually see that this is budget neutral for the state. And there's certainly some administrative costs, and many states will keep a small percentage of that federal revenue coming back in to help offset those. So certainly can't speak to the specifics of Kentucky, but I know in quite a few states, this ends up being a win-win because it ends up being budget neutral for the state. Great. So we have received quite a few questions also about the number that I shared regarding the return on investment of $48 million from Georgia. I shared that is just for the state of Georgia that they are estimating, so that they would see an increase if they just bill for existing services delivered by school nurses specifically who are already within schools, that they would see an increase of $48 million, which is tremendous, and that would be per year. And that's on par with what we're seeing from some other states too. So just again, underscoring that this is a significant opportunity in terms of being able to expand access to resources for those services. And another question, Christie and Wayne, is around data sharing. And this may not have been an issue just in terms of your care coordination, but wanting to know if there were any agreements in place between Kentucky Department of Education and Medicaid to kind of facilitate that coordination through the sharing of data.
And Wayne, jump in at any moment, but we did have an agreement between the Department for Medicaid Services and the Kentucky Department of Education to share the data for the purpose of completing Medicaid claims for the IEP services. And so the extension of that agreement was what we were in process of taking care of.
Right, nothing to add there, Christie.
Great. Thank you both. So I know we're coming to the top of the hour. We have received a handful of additional questions wanting to understand what the status of this work is within your state. the map that I shared earlier, if the state is in gray, it doesn't necessarily mean that there isn't work happening around this within your state. It just means that a formal request hasn't been put forth to CMS to make this change, but certainly we know there are a lot of efforts that are happening. We are doing our best to track those. So if you're from a specific state, please feel free to reach out to us. We'd be happy to connect you with efforts that are happening in your state, and can certainly share some of those additional resources which have information on how to move this forward within your state. So I will go ahead and close us out then. I just want to thank everybody for joining today's webinar, and a huge thank you to Anna and Wayne and Christie for presenting, and Rochelle for moderating. And we welcome any follow-up questions that participants have, and we'll share by the end of the week the recording, PowerPoint slides, and additional resources. So thank you so much to everybody. Bye.